Good morning, everyone. Thank you so much for joining us this morning for our webinar on how to support students with anxiety. My name is Holly Bell. I am the Equity and Advocacy Specialist for the Utah State Board of Education. Part of my role is to oversee and educate on Section 504. So before we begin and I introduce my guests, I want to tell you just some logistics. When you're on YouTube, there's a chat feature, and if you want to receive credit or be acknowledged for attending, please type your name into the chat box. We do have our state nurse consultant, Betty Sue Hinkson, here, and she will be monitoring the chats. And we will be accepting questions throughout the webinar, so feel free to ask questions, and she will be monitoring those questions. There is sometimes a slight delay, so we will get to your questions as soon as we can, and there will be a time for questions at the end. So before I do an introduction of the webinar, I'm going to let my guests introduce themselves.
So I'm going to start. My name is Lauren Rich. I'm the president-elect of the Utah Associations of School Psychologists.
And I'm Cecily Rawl. I'm a school nurse with the Granite School District.
I'm Deborah Mylan-Nyler, and I'm a school nurse with the Salt Lake City School District.
So the reason we came together to produce this webinar is, as I'm sure that you are aware, there seems to be a rise in anxiety for students in school. And my background is in school counseling. I was in school counseling for 10 years. And as a school counselor, I had a lot of students come into my office who had severe anxiety or moderate to mild anxiety. And so a lot of the parents were asking for Section 504 plans, and so that's something that we will discuss because it's difficult to decide if a student is in need of a Section 504 plan. So we'll discuss that during the webinar. But the reason I called together school psychologists and school nurses is that we are a system of care for supporting students, and all of us are seeing this rise in anxiety in our offices, and we can work together to support those students, and we need to work together to support those students and increase our communication with each other and those supports. So with that being said, we have a PowerPoint that we're going to share with you, and please feel free to ask questions as we move forward. The three professions that work closely with students experiencing anxiety are school counselors, school psychologists, and school nurses. I'm going to let Lauren talk about what school psychologists do.
Great. So I put this nice little illustration on the slide just as this is what we usually share with people when we go over what do school psychologists do. We're very similar to school nurses and school counselors in a lot of ways, but there are some very specific items that we do. Regarding 504 plans, I would say the biggest difference is that we're doing the assessments and we're doing a lot of the observations and measurements regarding anxiety. This nice little illustration shows, that we provide services, we support students and teachers and administration in, creating school cultures and consultation and behavior plans and making sure that things like 504s are in place for students. On this, it also says, our recommended ratio, and that's not necessarily relevant to this, but I think the main takeaways are, we are experts in learning and behavior and mental health and school system structures.
So school counselors often serve similar roles as school psychologists because we do have school-based mental health training. We focus on foundational skills on prevention, intervention, and postvention, and access, attainment, and achievement. So we do work with students on their career paths as well, and part of that is looking at the whole child. And so we do look at a system support and a solution-focused approach. And as students come in with anxiety, we do assist them in any type of services that they may need or accommodations. School nurses do a lot.
So this is an overview of the Utah school nursing practice, but each Utah school district nurse may vary in the professional practice. So some of the aspects that are specific to anxiety and mental health include, because that picture, there's a lot that we do. We're a member of the school team. We're a member of the 504 IEP team. We are part of the crisis intervention, student advocate, behavioral health support, social emotional wellness, and ethical practice.
So this is the CDC framework of the whole school, whole community, whole child model that addresses health in schools. This model is student-centered and emphasizes the role of the community in supporting the school and the connections between health and academic achievement. It's comprised of 10 components that exemplify how public health and education work with the child in the school setting and with the community resources collaboratively. Often when we're working with a child that has anxiety, it's helpful to not only know who to refer the child to in your school, but also it can be very helpful to know the mental health resources that are available within your community for mental health referral purposes. And we have further resources on the whole school, whole community, whole child model in our resource section slide at the very end of the presentation.
So let's give you a perspective on why it's important for us to focus on mental health with students, and anxiety is, as you will see, it's one of the highest rates of diagnosed mental illness for students. So you might be aware of the CDC report that came out in 2017, specifically for Utah, that there was a 141.3% increase in suicides among youth ages 10 to 17. And we are seeing that that is a reality for our students. And that's compared to 23.5% at the national level. And so NAMI, the National Association for Mental Illness, reports that 1 in 5 students experience some severe mental disorder at some point in their life. And 70% of those students don't seek help. And there's a lot of different reasons for that. And so 54%, and more than half of people who died by suicide, did not have a known mental health condition. So it's important as educators that we are looking for these risk factors and these signs of students who may be experiencing mental health issues. So as I was stating, anxiety disorders are the most prevalent emotional disorder of youth, with an estimate of 2% to 27%. And as you probably have seen, social anxiety disorder and social phobia is the most frequently diagnosed anxiety disorder. So these are our students who have low attendance and have difficulty coming to school and staying in school the full day. And then the second, following by social anxiety, is generalized anxiety disorder. For children and adolescents, anxiety disorders significantly predict lower standardized test scores, impaired school performance, chronic school refusal, attendance problems, academic failure, and premature withdrawal from school. So Lauren's going to talk about the 3 general categories of anxiety: the behavioral, cognitive, and physical symptoms.
Okay, so some of the behavioral symptoms, I'm sure that if you're working in schools, you've seen with students, right? And this can be anywhere on a spectrum. There's some students that we can automatically spot and say, I think that student is having some anxiety. And then there's a lot of anxiety behaviors that manifest a little bit differently and might not be so easy for us to spot as anxiety. Sometimes anxiety behaviors can come across as, defiance or a lack of motivation, attention deficit disorder. So it's really important for you to kind of familiarize yourself with what anxiety can look like and that it's not always the same symptoms for every student. Some of the things that manifest with anxiety are avoidance of academic or peer activities, asking a lot of questions can be difficult. Speaking in front of a class can be an anxiety trigger for a lot of students. I think that there are certain activities and academic areas that are anxiety provoking for each student. That's a little bit different in their own competencies and what they feel comfortable in, so that's just important to remember. Transitioning from home to school can be difficult for those students who have, separation anxiety, and I think that we all know those students who their parents have a hard time getting them to school. They have to drag them out of the car, it's a fight every morning, they're kicking and screaming, or even getting them into the building can be, a big tantrum. There are some students that will self-isolate, so they sit alone or they don't really engage with peers at recess, or maybe they're the kids that really want to stay inside with the teacher during recess and make up a lot of excuses, like it's cold, I don't want to go out, nobody likes me, and I think that's really just them communicating to you, it makes me anxious to go outside and be around a lot of peers. Some students will have panic episodes when they, will leave the room or walk around the school or even leave the school building, and that can be dangerous, but it's also, I think that you have to monitor what's the student accessing. Are they staying safe, or are they just leaving a situation that's anxiety provoking? Those are some of the big behavioral symptoms that can happen when students have anxiety. Some of the other things could be, you're okay, I'll just add on.
Okay. We'll leave this slide here.
It's okay. Some of the other behavioral things that can happen, are in class students having a hard time starting work or things like that. And we're going to go into a little bit more in depth about how to spot those and how to create accommodations for those behaviors. As far as cognitive symptoms go, a lot of students with anxiety won't have great memories, right? You'll be like, I just told you this, and you don't remember this. And a lot of the time it's because even though they look like they're listening, they're probably not. Their brain is racing, their heart is racing, they're uncomfortable, and what's going in one ear is going out the other, and they're not being able to store that in any short-term or long-term memory. Difficulty concentrating, right? It's hard to concentrate on the work you're supposed to be doing when your body is dysregulated and you're having some fears about things. Excessive worry, this might look like students in your class, continually asking the same question over and over again. When are we going to go to recess? Bobby Sue over there is playing with her pencil and it's loud. Or what are we going to do when the sub comes? And how are we going to handle, a fire drill? Even little things that they continue to worry about. For academic performance, if you're dealing with all three of these cognitive symptoms, it's not surprising that you would have some poor academic performance, right? Your brain is not allowing you to engage with the academic instruction that's happening at the time. So you're missing out on instruction, and therefore you're not going to be performing at your best capabilities.
So when a student that may have anxiety, they will present with some physical symptoms, but sometimes it is difficult to ascertain really what is going on. And so when we are considering the child in the school setting dealing with anxiety, this slide includes some of the symptoms that a child may report or display. So a student may complain of a headache, or their head hurts. Gastrointestinal complaints may be my stomach hurts, they feel like they want to vomit, nauseated, their stomach's burning. They may feel restless or agitation. You may see them like tapping their knee, moving their body parts, feeling lightheaded or dizzy. And many also hyperventilating, or they make themselves breathe really fast because they're concerned, what they're worrying about. They may say their chest hurts or their whole body hurts. But many times the somatic complaints that I just discussed also have to do with the developmental age or the grade, so it may manifest itself differently. And also that many of the somatic symptoms that I talked about can cause students to miss more school and more frequent visits to the nurse's office. The slide represents when a teacher or other staff may observe in a classroom, either verbally or non-verbally by a student. So anxiety not also presents itself with physical symptoms, but also may manifest with social and emotional symptoms, keeping in mind, again, the developmental level of the student. So these are, again, some symptoms that you may observe as opposed to what the student expresses.
So individualized healthcare plans are plans that are developed and written by the school nurse for students whose chronic health condition affects or has the potential to affect safe and optimal school attendance and academic performance. Healthcare plans are one way that school nurses are really pivotal in being involved with kids that have anxiety. Healthcare plans include the following information: a confirmed medical or mental health diagnosis by a healthcare professional. Sometimes when we have a confirmed medical or mental health diagnosis, it may require us to give medications in the school. So the healthcare plan would include medication, how we're going to give it, when it's required during school. This is a private and protected student health document. It's always student-centered and always concentrates on the student's individual performance, needs, and cultural beliefs and values. The school nurse coordinates and develops the healthcare plan with input from health providers, parents and guardians, and members of the school team that we work with.
And with the nurses, again, the nurses develop the school health plan, and it may or may not require a health plan or a 504 for additional educational accommodations. Dual diagnosis, I'll go through them, but dual diagnosis is also called co-occurring disorders. Again, the health plans and 504s are specific to the needs of the student. So there may be a confirmed medical diagnosis by a healthcare provider that may or may not include, it may just include the educational accommodations, it may include a healthcare plan. Orders or interventions requested by the healthcare provider, most of the time there would be a individual health plan. Do a diagnosis of anxiety without medication given during school hours may or may not have a individual health plan, may just have a 504. Dual diagnosis, example, depression and anxiety, mood disorder and anxiety. Many times there will be a healthcare plan, but again, it is up to the individual student. There may be 504 accommodations. Medication required during school hours. There may or may not be a healthcare plan, but there is a procedure and policy for giving medication during school hours.
So what are the benefits of having an individual healthcare plan for students? A few of the main benefits are it provides a legal documentation for the school nursing services that are being provided for that individual child. It promotes fluid communication and continuity of care with school staff, medical professionals, and parents and guardians, which is invaluable when you're dealing with a child with anxiety. The continuity of care between home and school can create much less stress for a student. A healthcare plan facilitates students' self-management for their chronic condition and supports quality assurance of school nursing services by providing criteria for review and evaluation of the student's care.
So school nurses are pivotal in being part of the school team. specifically when a student either has non-traditional enrollment or when students are being transitioned from an outside agency, that may be hospital, day treatment, clinical settings, home hospital, home school. Nurses are instrumental in helping create a healthcare plan, but it's also the school nurses with the school team help coordinate from when a student is being discharged from, let's say, an outside agency, a hospital, and re-entering into school. For students to be successful, it's extremely important that school nurses and are part of the transition team in developing so that they are successful in school.
So what are some best practices for transitioning back to school for the student with anxiety? Key point is to identify a point person to help support the student. And this may be one person, it may be a team that includes a teacher and then school psych, school nurse, or even the school social worker. Communicating critical information between student support teams are critical for the child with anxiety. And these include the caregiver, the school nurse, the school counselor, school psychologist, the healthcare providers that the student may be seeing, administrators, and teachers. Always consider with a child with anxiety partial day attendance at first to ease the transition. Developing a crisis plan for the student can help tremendously in the schools. And then scheduling a 504 or IEP team meeting can be very useful in supporting the child. Set a clear plan for addressing long-term absences and missed work, and allow for adjustment in classroom, home and homework upon return. Always check in with the child on a daily basis, if at all possible, just so they have a one key person in the school that is their go-to. Provide regular feedback to their caregiver on students' adjustment back to school. Always checking in with the parent as well to see what may be needed to be changed throughout the school day. And then provide family peer-to-peer support if at all available.
So here's a form that we put together, and we'll share this with you. Just when a student is returning from one of the out-of-school environments, it's important that we all get on the same page. And so hopefully this can help you so that we're all sharing information, that we're all developing a plan together of how to support the student. Some of the things that I've seen in schools is that this system is not, everyone is not aware. And so actually at the bottom of the second page, we put that you should give a copy of this to several different members: a parent, guardian, school nurse, school counselor, school psychologist, principal, students, teachers, coaches. These are all the people that will be interacting with this student when they come back. And it, even no matter what the condition is that they've been out for, it can create some anxiety. And we're going to talk about 504 plans, but a lot of the times this is a key that a student might need a Section 504 plan or an IEP. If it has gotten to the point where a student has to leave school to have out-of-patient treatment and various situations, coming back for them, that's an indicator that they may be a student at risk that is in need of one of those plans. So hopefully this can help you to get organized and make sure that a student's return is a smooth transition. Okay, so here's the burning question that I hear a lot as the Section 504 specialist, and all of our professions here are trying to figure out. Is there black and white? No, there's not. I can't promise you that today. I wish I could. But there are some key things that we can consider. So a lot of people don't understand what Section 504 is. So I want to explain that to you. It's a federal civil rights law under the Rehabilitation Act of 1973. So in 2009, the ADA Amendments Act became law and broadened the interpretation of Section 504. So this is where mental health impairments came into the picture and expanded. So students with disabilities, and if we have a severe anxiety condition that's considered a disability, in school settings fall under the civil rights protection of Section 504. So this law, it is a federal law, prohibits discrimination on the basis of disability in all school programs and activities in public schools receiving direct or indirect federal funding. So that includes all of our public and charter schools. They are all bound by this law to prohibit discrimination. So it's designed to provide equal access and fairness in general education to students with disabilities through their 504 accommodation plan. So let's define what a person with a disability is under Section 504. So if they have a physical or mental impairment that substantially limits one or more major life activities, and we are going to try to define that a little better for you, but that's the key, is it substantially limiting one or more major life activity? Do they have a record of an impairment? Or are they regarded as having such an impairment? So are people perceiving them as having this disability? And a student is eligible for a Section 504 accommodation plan if an evaluation shows that the student has a mental or physical impairment that substantially limits one or more major life activity and bodily function, and it impacts their student education. So here are some examples. So I say examples of major life activities. This is not an exhaustive list, but it is pretty definitive of a lot of what major life activities are and major bodily functions. So here's some definitions. Substantial limitations. So this is the real question that people are asking. How is something substantially limiting? The key with Section 504 is this is a group decision. There's not one person who is deciding whether or not the student is substantially limited by their disability. Not the parent, not the counselor, not the healthcare provider. No one person is deciding what is if it is a substantial limitation. So we're working on an individual student basis. And we're looking at a variety of sources. Episodic impairment, so if this is a disability that is not always present. So if you're looking at seizures, which the student is not having every day, or seasonal allergies, but this is something that when it is active, it can substantially limit the students' access to general education. If they have a record of a disability, so if they have a history, even though they do not currently, so if you look in their IEP or a previous 504 plan, that it's not currently shown, then this is something that you maybe need to look at if there's a record. And then if they're regarded as having a disability, that's if other people treat them as such. And then a qualified individual with a disability is a student who has been diagnosed or determined that they have that disability and are school-aged.
Okay, so I'm going to go kind of over the testing and qualifications for 504. So there's some similarities between when you test for an IEP and when you test for a 504, right? So you still have to do it within a timely manner, and that has been determined to be 45 days from when you receive parent consent at this school. you need to evaluate. There's not really an if, and, or but there, right? If you receive parent consent or if there are concerns, you really do need to do some testing and some investigation into that. There's no specific process for a 504 evaluation, and each district is sort of responsible for making sure that the components that need to be in the 504 evaluation are there. So whatever district you're in, make sure that you understand their processes, but also you should know for yourself what you should be doing just so that you're using best practices. For an anxiety evaluation, some of these things are relevant and some of them are not, right? For an anxiety evaluation, you probably wouldn't be giving an IQ test regardless. That could be part of the concern, but usually is typically not. But if it were, you have to do more than just an IQ test. So you can't just give a student an IQ test and throw them in a 504 plan. You do need to measure some specific areas of need. So if you have a student with anxiety concerns, that means that you need to evaluate the anxiety concerns, right? Are they having a hard time attending class? Are they having a hard time concentrating? Is it work completion? What about the anxiety do you need to measure? You have to select them appropriately and they need to be validated. You can't just make up an assessment on the fly. You need to use things that are validated and normed and appropriate. And they need to be administered by the appropriate person, which usually is the school psychologist. Or there are parts of the 504 that are more appropriately done by the school nurse or by the school counselor. So the big difference here is that in a 504, you don't need to have the third prong of an educational impact. That major bodily or life function can be something like concentrating or maintaining body regulation or staying in the classroom. Those are all major functions, right? And you don't necessarily need to have a student who's struggling academically. That's the big part. So for a 504, I want everyone to remember this. You don't have to have a student who has poor grades or is starting to fall behind or failing classes. They can be a really high achieving student who's doing fantastically in school, but also needs a 504 in order to meet those accommodations for their major life functions. So that's really the big difference between IDEA law and 504.
And one of the things of confusion that I'm seeing is people are thinking that they need IEP and a 504 separately. So students who have an IEP are already protected under Section 504. So all of the accommodations that you would put into a 504 plan, if the student has an IEP, they should be rolling them into the IEP. You do not need two separate documents.
Agreed. Yeah, the only time I think that you would ever even go to a 504 is, let's say the student was on an IEP and they no longer need, goals. They just need the accommodations. You would switch to a 504. But yeah, you never have both at the same time. You can have a health plan and an IEP, or a health plan and a 504. But yeah, never an IEP and a 504 together.
And the health plan needs to be a separate document.
Yes.
And it sounds like we have a question, but it has to be a separate document. One of the reasons for that is that it can be changed and monitored at any point in time, where the 504 you always, and the IEP, you always have to reconvene the team.
Yeah.
So with an individual health plan, that can be changed. Is there a question, Macy?
There is. Do you have recommendations for evaluation tools for anxiety?
Yeah, so I think that some of the best tools, and that's actually on the next slide. So go to the next slide. That's perfect timing. Thank you, person with the question. Okay, so you don't need a diagnosis of anxiety, right? I hear a lot of school teams that go, he doesn't have a diagnosis. We can't give him a 504. And it's like, no. It doesn't matter if you have a diagnosis of anxiety. And you certainly cannot ask parents to go get a diagnosis. That's a big no, right? Because then you're putting your district at liability for paying for that student to go get the diagnosis. So you go through the process, right, that's delineated by your school district team to complete the testing. And then here are some tests that usually I would suggest give you some really good information on what the student is experiencing at school. Some of the standardized rating scales are the BASC, and they're, not everything on the BASC is going to be related to anxiety, but it does have some key components that will show you some peaks and valleys that are related to anxiety. The Connors, I would say, there's a Connors early childhood if you're looking at little kiddos. There's a Connors 3, and that's related to ADHD. So, and sometimes that's relevant comorbidity, and you need to look at both. Or there's the Connors general behavior rating scale, and that takes a broader look at everything and does have a lot of pieces that are related to anxiety. The MASC. The Beck, the Brief, and the Hamilton are all sort of really related. I would say whenever you're doing an anxiety-related 504, you should definitely be looking at executive functioning. So I think your 3 prongs that you're always looking at if you're going to use rating scales for anxiety are some scales that directly ask questions about anxiety, a scale for attention to see if that's related, and a scale for executive functioning. And executive functioning, if you're not familiar with that, is sort of the things that we ask students to do in school related to their brain's ability to attend, to block out other stimuli, to get started and initiated on tasks, to change their attention. And those things can be really highly involved when you have anxiety, and it's difficult for you to do those things. I would also say the thing, you definitely need to have an observation, right? We should probably never be doing an assessment or an evaluation where we never watch the student in their natural environment. We have to go on safari, right? You can't do evaluations and then just say, yep, that's perfect, it looks exactly like the child I think it is. You have to go watch them in a variety of settings, because there might be some things that you're missing when you don't go physically watch them that maybe you're not getting from the assessments and the rating scales. I would say using parent, teacher, and student interviews, asking parents for a developmental history of the student, even if the nurses haven't done a medical one, just a basic one of when did you notice these concerns? Has this ever been a concern to you? You can get some really valuable information from those more informal developmental histories. A medical history, and that's something that you would work with your school nurse on, because they're really good at that, right? Make sure that you have an appropriate medical history, and a record review for anything that's in their educational files, because they might have been a student that came from another school that the same things have been happening for years, and you wouldn't know unless you're going back through those records. Does that hopefully that answers that person's questions on the assessments.
And it can be a variety. I mean, you can have a previous 504 from another school.
Yeah.
You can have each person on the team can bring whatever they have to the table.
Yeah.
And talking with the school nurses, we see that there is the healthcare provider can provide very key information, but that's not always communicated back and forth. And so if you can get a release of information with a medical provider, that can really help. If there is a medical provider, we said that you don't need a diagnosis, but that could be a really helpful piece of information. And if the physician or healthcare provider would actually talk with you, maybe it's an outside therapist.
Okay, good, great.
You gave a perfect answer. Good job.
Good for me. Yeah, I would say it's just really dependent on what your concerns are about the student too. Like sometimes I will throw the whole gamut at a student because I'm really looking for a lot of different things, and sometimes it's very specific. Like I've got a medical history, it tells me some really specific pieces, and I just want to update on how their anxiety is manifesting. So I only give 1 to 2 scales.
One more comment.
Sure.
It's not a question, it's a comment. Very good help with many students having different needs but not qualifying for IEP. Many of our parents do not understand 504s and think kids need SPED services.
Yeah,
This
and
is true.
I think that's
Very
very important to discuss with parents too, especially when you're meeting with parents who have concerns. A lot of the times parents don't know about 504s, so they come to the school team and they say, my student needs an IEP, because they know that language. And if you can sit down with them and talk about the difference between a 504 and an IEP and how you can help their student with just the accommodations around anxiety, I mean, that takes a lot of conversation with parents and knowledge on your part to be able to explain it, but I think that that's a really good point. A lot of times parents just need some education around what their student can get from a 504.
Also, I think if the student is seeing an outside therapist, if that therapist, if you can get a release of information, and the school psychologist or even the school social worker can talk to the therapist, maybe we can provide more continuity of care also
That's a great point.
between home and school.
Yeah, that's a great point. I think that's really important. The other thing, now that you said that, I was going to mention is sometimes you'll get a note from a doctor or from a therapist writing a prescription for an IEP or a 504.
Yes.
Yeah, when you get those notes, I think it's just important to note, A, you don't have to do that. B, I think that's a conversation to have with the parents about what were they talking about with their medical provider, that the medical provider thinks that they need to have that, and then look at what do they actually actually need, and what as a team would you actually suggest that they have. So
Well, and the parents need to understand this is a helpful piece of information. Thank you so much for bringing this into us, so that when we have our team meeting, we can have that as a piece of information.
Yes. Yeah.
And, it can be helpful to have that healthcare provider on the team if the parent decides to include them.
Yeah.
But don't forget the school nurse. I feel like the school nurse is forgotten a lot, to have them part of the team, because you can provide really helpful information. And the team can be comprised of whoever that you want, as long as they're knowledgeable of the student. And a lot of times it could be a new student that comes into the school. And you don't have to have all the teachers there, but it's helpful to invite maybe one or two of the core teachers, because they may not be knowledgeable of the student, but they can help contribute a knowledge about how the student might be successful in the classroom setting. And so really you don't have to include the whole 20 people on the team, but carefully select those that would be appropriate for that particular potential disability. So these are the burning questions that come to me that I want to make sure I clarify. A lot of people don't know that a student cannot be served under Section 504 if they have revoked their services under IDEA. That is if they've revoked it. It doesn't mean if they don't qualify, they can still receive Section 504 services if determined that they need them. But if they revoke their services under special education, they do not qualify for Section 504.
Can I add
go
in
ahead.
there, Holly?
Yeah, add that.
Because I hear this a lot too. If I hear teams saying they revoked, they can never have a 504 ever again.
That's
it's
a
like
good
no.
point.
If they revoke, they're basically saying no for right now. But at
Yes.
any point ever, like tomorrow, they could come back and say, "Just kidding, we want a 504," and you can give them a 504.
And and you need to bring the team together and reevaluate. It's like you're starting all over again.
Yes.
And in fact, if you do have an IEP meeting and they don't qualify, there's a misunderstanding that, okay, well, we're just going to switch into a 504. You need to convene another 504 team meeting. It's a separate thing. Now, you can use the information that was gleaned out of the process of determining eligibility under the IEP, but it's a separate meeting. So you don't combine them together. You can have it right after, start it 10 minutes later while you have the parents there, but it's a separate meeting. So a lot of times there's a misunderstanding about we need to have 3 weeks to look at, to provide interventions. And so what I always say is, okay, so a parent comes into you give them their options. So, if you're not observing these things in the educational setting and the parent is observing them at home, it doesn't mean they might not need a plan. Because if you think about it, if you have a student who has, are high functioning perfectionist students, they are vigilant in class, they go home and they are up until midnight, they want to make sure their assignments are perfect. That impacts them when they come to school the next day. And so just because something is happening at home that you're not seeing in school doesn't mean that they don't have a qualifying disability. So there's a question.
A question from the audience: as the school social worker, can we refer and recommend outside counseling therapy services?
So you can, so if the social worker is part of the team, that's an important person that can be part of the team. If the team decides that they might need those services, they have to be careful if they refer, because then again you can risk the liability as far but you can give them resources. For instance, I was in Jordan District and we had free services at the Jordan Family Education Center that you could recommend to the parent, hey, we have this free counseling after school that you can access. We have free courses. So if you can give them options, it can be a recommendation, but not a requirement. I doubt that there would ever be a requirement in, a Section 504 plan.
Yeah, you just have to be careful of your language. You never need to, you never say your student needs counseling or your student has to have counseling. And if you are recommending outside therapists, that's totally fine. Make sure you're recommending at least 3. That way you're not endorsing one. Because if you just recommend one therapist to a parent, you're endorsing that therapist. So give them a variety of options. So basically present it as resources. Say, I think your student may benefit from some of these resources. If you have more questions, let's talk about them. Here are a list of these providers.
Holly, I just wanted to add in that with individualized health plans, a parent or guardian may not want to have a health care plan at a specific time, and later on, just like with the 504, they may want a health care plan at a later date, and if their medical diagnosis or medication or things change, that is an option at times also.
I have a lengthy question.
A lengthy one.
A lengthy question. So we have one participant that says she oversees academics for girls in a residential treatment center for eating disorders. We treat girls from all over the country. Most schools are good to keep girls enrolled and provide services while they're in treatment, but without fail, a couple of districts in Texas refuse and insist that students automatically disenroll if they miss more than 10 days of school, regardless of the reason. When I've cited 504, Section 504, which requires them to provide a free and appropriate education, they say that their state laws, which don't require that for kids who are away from school for medical reasons, take precedence. What's your take on that?
That's a tricky question.
Yeah.
If the student has a 504, so let's say you're serving a gal in your treatment center who was from Texas and has a 504, and don't quote me on this, I need to look this up, but I'm assuming that if she has a 504 in place, they still need to have her enrolled.
Well,
But the 10-day period, I mean, that does happen. We do that here too.
that's the federal law.
Yeah.
Is that they need to receive a free appropriate publication. Or did I say publication? Education. Free and appropriate public education. And so whoever is providing that, if they have a diagnosis, I mean, every student
Yeah.
is appropriated that.
Typically, if they're typically our students who are in a day treatment setting, if that day treatment setting is not providing the education, then the school provides home hospital, which means they come in and provide the instruction to the students. So I think that's a specific question that we would need to look at a little bit more closely. But generally, if the day treatment placement is not providing the academic instruction, the school provides home hospital, where they send a teacher to either the student's home or like a community location like a library, and they provide them with some academic instruction.
Well, and in fact, if that person could contact me, we can do more research. That's a pretty complicated issue when a student's in residential treatment and needs academic services. But they have the right to a free appropriate public education, no matter what setting that they're in.
Right.
As long as they are school aged. And it really does fall under the school that's receiving the federal funding. That student is still considered part of their student enrollment. So yes, if they want to contact me, we can dig into that a little bit more as far as Section 504 law is concerned. And so I want to go back to this RTI question. So when I say you have parents come in and you give them their options, you can say to them, and if they say, I want a 504 plan, say, okay, so that's something that we can look at, but let me tell you what some of your options are. So that is something that we can consider, and if you want to, we can try some interventions before we look into that and see how those work out. Or we can convene a 504 team and make that determination. When I said before, sometimes the school is not seeing these manifestations of this disability, and so that can make it difficult for the school team to have any sort of evaluation, any sort of data to work with. And so if you do have some pre-interventions, then that can be helpful. But if the parent says, no, I want a 504 plan, and the team decides to evaluate, the team can deny a parent. Now that doesn't usually go over very well when they say a team meeting really is not that difficult to put together, but if they want to deny the evaluation, they can. But if the parent is requesting it, or if there's someone referring, so there can be a referral under child plan. There can be a referral from the social worker who is at residential treatment. There can be a referral from the checker at the grocery store. It doesn't even matter, but typically it's from a parent, a teacher, a counselor, someone who has made these observations and thinks that this student might have a potential for services under Section 504. And so you can say, all right, well, sign this consent. You always want to have them sign a consent. And then under Utah law, so throughout the nation it's often 60 days, but in Utah you have 45 days, school days, to determine eligibility. Now, with RTI, you can be doing interventions during those 45 days. And then, because when you come together for an evaluation at the end of those 45 days, if you decide to have all 45 days, you've got more information because you've been doing interventions. Now, you don't have to take 45 days, but I'll tell you, a lot of times if we have 2 weeks from the end of the quarter, this is what happens a lot. 2 weeks from the end of the quarter, my student has anxiety and they need an extension on this test. They need extended time. They need to have, move forward. They need to have, this and that and the other. But you can explain, okay, here's how Section 504 works. We need this time to make this determination. And if it's 2 weeks before the end of the quarter or the semester, they don't have 45 days. And so if the parent understands that, this is not something that we can just put together in 3 days necessarily. We need to look at all the information that we have. So a lot of times that can kind of dissuade them from seeking that out, or maybe it's something you have the potential to look at in the future. If they legitimately are feeling like this is a disability my student might have. Do you have a question?
Question, what is RTI?
Oh, response to intervention. So these are your interventions. That's a good question. We have too many acronyms in education. So they're your tiered intervention system. Is that
another comment?
Yeah. Mm-hmm. Yes.
Okay.
Tiered interventions, and
Tiered
you're looking at
interventions.
basically, is your student responding to the interventions that you're giving? And typically, if a student is progressing based on the interventions, it's an indicator that maybe they don't have a disability, they just need a change in their educational accommodations, or they needed some extra boost in some areas, and that's a whole different presentation, coursework, multiple courses.
There's another comment from Utah. Pardon me. Utah Parent Center can always help connect families to outside resources as well. Schools can
yes.
refer
Mm-hmm.
to Utah Parent Center so that schools don't have to take the chance of liability.
Yeah, that's a great point. There's a lot of resources that are already, like Utah Parent Center or 511, 411, 211.
211.
Thank you.
211.
211 also has a good list of providers and resources. So if you have a parent who's looking for something, most of the time your school district student services will have a handbook too of like, here's a mass amount of resources a parent can direct to.
Well, and I have seen Canyon School District has a great pamphlet for parents about Section 504. We have a parent guide through the state office on our website that you can provide parents with. And just so you know, at the Utah Parent Center, they do have someone who is bilingual, speaks Spanish, and this can be helpful for our parents because this is about access to education. So there needs to be equity for all students, and that's why we can't require a diagnosis, because there might be parents who don't have access to healthcare providers that can provide that diagnosis. That would be considered discrimination. So I can't remember where I was at before.
You're on the third tier now, so 45 days.
Okay, 45 days. So, and then I just said no medical diagnosis or official paperwork is required. And this is just, I can't drive that point home enough. And like you said, a doctor's note does not determine that if the student receives a 504 plan. Now, we have a guideline manual on the state website. There's a link to that. And we're going to send out this PowerPoint. There are some links on there. So you can find that on our website that really breaks down a lot of recommendations for accommodations, that breaks down the law, what the team should look like, the process. Everything is in there. So any other questions from the audience right now? Okay, great. We can
Okay. All right. The next slide I'm going to cover is just sort of what are the accommodations that you should use for students with anxiety with, on a 504. Because there's a lot of options, right? And sometimes we throw the same set of accommodations at students over and over again, which isn't necessarily best practice and won't necessarily help that student, right? As we've discussed before, every student's anxiety is different, their triggers are different, and it manifests a little bit differently. So the key component I think is important is what can you change in the student's environment that will have an impact? Not how can I change the student, right? Because that's not your job and you can't force the student to change. So what's within your control that you can help the student change their own behavior and manage their anxiety a little bit better. The other thing that's really important to consider is student behavior is all communication, right? So it's something about their anxiety that they're communicating to you and the educational environment. So I have some examples up here that I think are helpful for educators to go over. So let's say Holly is showing me some defiance during writing time. What she's really communicating to me is the openness of this task makes me anxious. I'm having a hard time deciding what I'm going to write about. What's the topic? Is this going to be good enough? And the way that you can help with that is do something like provide Holly with a topic sentence. Like you're providing her with a little bit of delineation and she can run with it from there. Let's say Holly's running around poking students when we're lining up for prep. What she's really telling me is this downtime when I'm not really sure what I'm supposed to be doing is making me really uncomfortable. So an accommodation for that is that the student during downtime has an activity to complete, like a leadership activity, or they need to run an errand for you, or they need to be the person who has a task during that time. Perhaps Holly is shutting down during science, so she's just not engaging with her peers, and she will refuse to do group work.
I've got a lot of problems.
I know. And what she's really telling me as a teacher is working with a group is not my jam. This is making me really uncomfortable. And what you can do for that as an accommodation is they don't have to work in a group all the time when they're in class. Maybe they can do tasks independently. I think that it's important to remember you're building skills, right? So a lot of times teams will say, well, I have them on a sticker chart and I'm giving them Skittles every time that they, work in a group or they complete this task. And that's important, but also if the student doesn't have that skill, it doesn't matter what you're reinforcing them with, right? Jessica Minahan, and we're going to talk about her a little bit later, her classic thing is, if you tell me you're going to give me $100 if I speak in French, that's fantastic. I really want to speak in French because I want that $100, but I don't know how to speak in French. So I'm going to continue to speak in English because I just don't have that skill. And I think you have to remember that about your students with anxiety, right? What you're asking them to do might not actually be capable within their wheelhouse of skills. And that's you can increase those skills, but the accommodations shouldn't be such that you're asking them to do something that they truly, physically, mentally cannot do. So I think it's just important to consider those things when you're creating accommodations, right? A built-in break might work really well for one student with anxiety, and it might not work at all for another student with anxiety. So it really depends on the student. The next slide.
Before we move on to the next slide, we've got 4 more minutes, but we're going to continue through the slides. We have a lot of information, but this is a big topic. And so we're going to continue on. If you cannot stay online, this PowerPoint, this presentation will be accessible at any point in time through the same YouTube link forever and ever until we take it off, but we won't. So you can access that, and if you are going through, if you have to come offline, if you are going through after the fact and you have questions, our contact information will be there at the end, and you can email us at any time with questions. So we're going to continue forward because there's a lot of important information, but just so you know, you're not lost if you end up coming offline.
Okay, so this next slide kind of goes over some typical accommodations for students with anxiety, right? You can provide a peer tutor from teachers, and there's a lot of material about how to best do that, right? You don't just plop a student down with another student and say, help Holly. So there's some good ways to do that, and it will be different for every student. You can modify their schedule, right? And this kind of goes back to, do they need to have a shortened day? Do they have medication side effects that kick in at the end of the day, and maybe they need to condense their academic instruction into one part of the day? That can happen for some of our students. Are they homebound? Do they have an online school? It's important for this modified schedule to talk about that coordination of care, right? When you talk to the counselors and the school nurses and the administration, and that re-entry form that Holly has put together is really important for that.
Well, one thing to clarify too is that if they aren't there for that period of the day, they're still they still need to receive a free appropriate public education. So just because they're at home, we need to make sure that we're providing them with what they're missing during the school day.
Yeah, and I hear some teams say, well, they need to be here all day or nothing, right? And that's not necessarily appropriate for students with anxiety. If they can't come to a full day of school, it's much better that they can come to part of the day of school than nothing, right? So we never want to say they're faking it, they just want to get out of this class, or they just want to be home because it's easier. That all may be true, but it also may be highly impacted by their anxiety. So make sure that you're really flexible with what's going to work best for the student. I would 100% rather have a student be at school for half the day and do well with that than a student not come to school because they realize they have to be there for the whole day. And your modified schedule doesn't have to be the same for the whole year, right? This is an evolutionary schedule for the students. So maybe at the beginning of the year they just come to a half an hour, and then you build up from there and make sure that their anxiety is manageable as the day gets longer.
Well, one of the things that I did as a school counselor is maybe switch the schedule around. So if their English class was the class they had the most anxiety, let's move that to a different part of the day where, and their anxiety is in the morning, then let's move that to a later part of the day. Of course, sometimes switching their schedule around causes more anxiety, and they would rather deal with it that way, but there are a lot of different options.
Yeah. Allowing makeup work to be extended without penalty. Sometimes we hear this from teams too, where I can't allow that because, then everyone wants to do makeup work. Again, it's really dependent on the student. So if that student needs an extra day to do their work, be flexible with that. Be sensitive to that transition back to school. They might not be ready to go 100% with their entire day and getting everything turned in on time, and they might not be great self-advocates already when they come back to school. So make sure when a student is transitioning back to school from any outside placement that you are very sensitive and flexible with them. I think it's important that whenever you're making accommodations, you're monitoring that student progress, right? Are you seeing any changes in academics, behavior, discipline, or attendance? And if you are, that probably tells your team that you need to change some of the accommodations. Or maybe there's some things that you've missed in your accommodations. So a 504, just like an IEP or any student plan, can be manipulated and changed at any time. And I think it's important that we don't just hand students a group of accommodations and then hope that they work for the rest of the year.
A couple of questions or comments on 504 accommodations for ACT, SAT tests. One person in particular says that this year found that ACT generally wants current medical documentation regarding mood disorders. They don't always accept current 504 plan as enough evidence to extend time.
Well, and ACT is ACT. They're their own company, and there's not any way for us to change their requirements and the accommodations that they will allow, unfortunately.
Yeah.
Healthcare plans have been submitted with the paperwork
As evidence.
as evidence also, as accommodations.
Well, and that's something that maybe with the parents understanding that, then that's something they can pursue. Of course, you can't. But there's just recommendations that we can make. And
Correct.
maybe it's just some of the things that they have considered.
Another question. So are attendance accommodations appropriate in a Section 504? How does that work when the state law stating 27.5 school hours are required each week?
Oh, this is a great question. So it's a federal law, so it trumps any compensatory ed laws. It's a federal law. So if we have state laws, federal law trumps state law. And so we just need to make sure that the student is having access to general ed, whatever that looks like. So, and again, it's a team decision. There really honestly, under 504, there's such flexibility, which can be frustrating because there's no delineation of who's on the team. There's no, that you don't have to even have a written 504 plan, which is really not very smart. You really want that documentation. You can determine whatever accommodation meets that student's needs. So federal law wins, and it's not, you can't discriminate for one student over another if that is the accommodation that meets those students' needs.
Okay.
Another comment, what about kids who never make it to school, are stuck on home hospital due to anxiety and hides from help, hide from the teacher, social worker, et cetera?
I mean, that's some pretty severe anxiety, so I think you're dealing with a separate set of issues, right? If you got to meet the student where they're at. So if they can't engage even at home, then you have to start building up at home. So, we call those anxiety ladders. When you meet the student, kind of you go up their ladder of anxiety triggering things. So maybe the person providing home hospital is, pretty anxiety provoking in the student. You can start really basic, like they just come into the house and maybe they don't even try to engage with the student, but they're there, and as the student becomes more comfortable with those things, hopefully they can build up to, it's okay, I'm okay sitting next to the person who's going to provide me home hospital, but we don't actually do work. And then maybe, the next week it's, I'm okay sitting here and we're going to do 5 minutes of work and then I'm done, I'm going back to my bedroom. And then eventually, hopefully you can get it to the point where the student's anxiety is manageable and they're actually getting instruction from the home hospital, social worker, or teacher. So there's really not a silver bullet for those things. It's just how can you get the student what they need, or attempt to get the student what they need, and eventually get them to the place that they need to be.
Well, and you have to get creative a lot of the time.
Yeah.
I've seen schools get really creative where maybe the student is more comfortable using Skype, something electronic where they
Online and
where they can see the teacher and participate in the class, but they're not actually physically there. It just depends. The team can really brainstorm and try to come up with some ideas of how to scaffold that and do something where the student is comfortable enough to get that education.
Yeah.
Maybe
I've had some high school students who are much more comfortable just chatting with their home hospital provider, so they'll send them some material like a PowerPoint, an assignment, and they'll be on GChat or something, and the teacher will chat with them when they have questions, make sure they're on task doing what they're supposed to, and then when they finish they send it back in. They're that's just a way that they're accessing free and appropriate education. It doesn't all have to look the same.
One more, can a student on a 504 have their accommodations apply to state testing?
I've got some documentation on state testing accommodations that has been provided by our state testing specialist, so I can share that with you. I don't remember everything that is on that, but there are specific accommodations that they have come up with for schools, so I can forward that. I sent it out through the 504 listserv, so if this person also should probably sign up for my listserv, and that I don't have the link right here, but it's I'd be happy to provide those resources.
So just moving on to some more accommodations, modified assignments, and I kind of touched on this with how I was helping Holly with her writing anxiety. You don't have to expect students to do the entire assignment by themselves, right? Again, it's one of those all or nothing attitudes where, it's much better for the student to do what they're comfortable with and gain proficiency than it is for them to do everything else that the other students are doing, right? So shorten their assignments, maybe every other problem, provide the prompt, maybe do the first 3 set of problems in any assignment to help them get going with their task initiation. The second one, identify an adult who can meet with the child and do problem solving. This can be, a check-in, check-out program can be really beneficial for students with anxiety, to make sure that there's a safe person in the school that they can go to when maybe they're having a panic attack or they need to leave the classroom. Sometimes if we don't assign this person, it ends up becoming someone. School nurses end up seeing students all the time who are trying to get out of class and find that safe person where they can talk about their anxiety, or we end up getting counselors and psychologists end up getting them once they've acted out and the teacher's like, get out of here, I don't know what you want. So if you can identify an adult in the school the student feels safe with from the get-go, that can really help with that. Prompting a child to use coping strategies. Obviously you have to teach the coping strategies first, and the student needs to be proficient in those coping strategies. But there's a lot of really subtle ways that a teacher can help a student recognize what's going on in their body and prompt them to use a coping strategy before it escalates, right? And that can be simple things like, after I've gone over what does your body feel like when you have anxiety, and how do you know and how do I know, then I can do something like a hand signal in class. Or maybe it's just like a head nod or something that me and the student have worked out privately, that kind of indicates to them, I'm seeing that you're dysregulated, and I think maybe you need to go take a moment to do your coping strategy and then come back.
Well, if you're the 504 coordinator, counselor, school psychologist, school nurse in your school, or if you're at the district level, these are skills that you can teach teachers. A lot of the time, they don't know how to make these accommodations in class. And so if you can do some professional development with them as far as these strategies, so they feel more comfortable when they respond to students with anxiety, and recognizing some of those signs and symptoms. And you can certainly use this PowerPoint and ask us questions on maybe some more resources for teachers if you want to provide them with professional development.
True, I'm definitely kind of skimming this. Okay, so testing in private, you know, if that's an anxiety trigger for the student, make sure that they have a quiet place to do that on their own where they're not surrounded by their peers. That, you know, this educate teacher about child's anxiety kind of goes with that other point. Make sure that the teacher understands a child's anxiety and what anxiety is and how they can facilitate the student's success in the classroom. Sending school assignments to hospital or to provide homeschool to teacher, and we kind of talked about the ways you can do that either electronically or in person and some of the options for that. Okay, this next slide we've already kind of touched on, so it's, you know, scaffolding the attendance. Again, being flexible and building up the students' skills is really important. And I've kind of delineated some steps for, you know, what I've discussed about how to get students at school if they're so impacted by their anxiety, you just can't even get them there, right? Like, allow them to visit the school when no one else is around. So let them come, you know, pull into the parking lot, sit there for 5 minutes, leave. You know, this will be a process for them. Let them come into the school before or after hours. And then kind of gradually increase the attendance that you're building in. Okay, I feel like I've kind of covered these, so we'll move on. Okay, transitions. Transitions can be an especially triggering time of the day for students with anxiety, and this kind of works for students in elementary and any other junior high or high school setting. They just look different, right? So for students with elementary, transitions can be something, you know, when we're moving from writing to science, or when we were on the computer and now we're transitioning to go to PE. The kind of lack of structure is really triggering for students because everyone's moving around the room. I have to switch my attention from one thing to another, and it might not be necessarily something I want to switch my attention to, and that can be really difficult. So the resource that I referenced earlier and has a lot of great ideas for this is the Behavior Code by Jessica Minahan, and it talks about this concept of sponges. So building in simple activities for students to complete before stopping and starting activities. So that would be something like, I'm going to tell my class, you know, okay, find a stopping place in your book. And when you're done, put your bookmark in your book, put it in your desk, and pull out a coloring sheet, or maybe it's something like Sudoku or a crossword puzzle, something that's really simple but cognitively engaging, and they can stop and start whenever. And then as soon as I notice all my students have closed their books, put them in their desk, and they're all working on this sponge activity, then I can say, okay, you know, put your sponge activity away, we're going to move on to computers or something like that. That can be really helpful with our students with anxiety because then they have something to do. Sometimes just sitting there waiting for everybody else to finish with the activity can be really anxiety provoking.
I don't know if you told them you worked in an elementary school.
I do work in an elementary school.
But a lot of high school, middle school students act like elementary students.
True.
And so they do.
The same concepts the same concepts apply. And for junior high and high school students, some of those transitions can be, you know, the literal transition from class to class. So sometimes a good accommodation will be allowing the student to leave 2 minutes earlier than the rest of their peers so they can walk through the hallway, get to their class. and be ready for that class before having to deal with the anxiety of navigating the hallways and getting around peers and being worried about being late. So that's something that's important for that. Another point that I put on here is, don't use countdowns. Usually students with anxiety, and all students, don't respond well to countdowns. So instead come to natural stopping points like ends of page, end of chapter, end of game, level, set of problems. I don't want to go super in depth to this, but I just want to bring it to everyone's attention that transitions are a great place to look at how your students with anxiety are performing and if it's a trigger for them. There's a lot of great accommodations you can put in place to help them with that.
And one of the things I want to add, and we'll get to the question that just came in, so I worked in the secondary education, look for semester changes. So when they have different teachers, even just a different map of the school where they're transitioning in the hallways, they're going to a different classroom, so maybe you can make sure that they know they are able to walk to each class, so they know, able to map that out and make that transition before the semester starts. Because even like you said, there can be anxiety, that they have a certain way they go, and to change that routine can cause some anxiety. And so meeting their new teachers, kind of helping them to make that transition. So maybe pull out those 504s before the semester starts and pull in those students with anxiety and say, hey, are you anxious about the semester coming up? How, let's use your coping skills. Let's remind you of your coping skills and see what we can put in place. Okay, what's the question?
Several asking for resources for professional development for teachers helping students with anxiety.
Jessica Minahan's The Behavior Code is designed for teachers, and my faculty and staff in a lot of the schools that I've come in contact with have kind of used it as a whole staff training, and it's fantastic. And there's a companion book to that. I would also say, there's a lot of different books. There's parent resources. I would say, don't we have a slide?
Put some resources at the end.
Okay, we have some resources at the end that I can't remember off the top of my head, but that we put in there. So I think when we get to that slide, we can kind of touch on that, if that's okay.
And if they want some more, then we can certainly provide.
Agreed.
This is one of the most helpful 504 trainings ever.
Awesome. Yay! Well, at the concussion training, I mentioned anxiety, and my email blew up. I said, all right, well, we better get this going. And that's what I saw in the schools as a counselor. So I'm glad to hear that feedback. And I certainly want to hear feedback on what you want to hear next, because I want to do different modules for 504. And the next one I'm thinking to do is ADHD. So maybe my email will blow up on please get ADHD, but it will be at the beginning of next year. So, okay, next slide. Our school nurses, I believe.
So we've talked a lot about, in this presentation, comorbidity, coexisting disorders. So what does that mean? So comorbidity refers to the presence of more than one diagnosis occurring in an individual at the same time. Not necessarily multiple diagnoses, but instead can reflect an inability to supply just a single diagnosis. So when we're looking at comorbidity and coexisting disorders, these can include anxiety disorders and ADHD, maybe anxiety disorders and a chronic health condition, anxiety and depression, anxiety and autism. Also, coexisting disorders may, three key points, exhibit more physical complaints and avoidance behaviors. The duration may be prolonged considerably, and always looking at an increased risk for suicide and suicide behaviors.
So to add to this slide, I'm sorry.
Yes, go ahead.
I just wanted to point out that if you see these things, so if the school nurse says this student has a chronic health condition, that should automatically be a red flag. So in pointing out these comorbidities and coexisting disorders, have that trigger in your mind. Okay, this student has been diagnosed with autism. Do you think they might have anxiety? Let's see what some of those things that are happening. Just have it automatically trigger in your head. ADHD. Oh, they might. also have anxiety. Chronic health, oh, it might also, just have that in your mind that could trigger anxiety. You have a potential in the student. Okay, go on.
So just keeping in mind, like Holly said, chronic health conditions are something that we always, as school nurses, create a healthcare plan for. Anxiety disorders would be something we would look for, but just like Holly said, as a team, we're all looking for any signs and symptoms of anxiety, particularly with our kids that already have a chronic condition that's been diagnosed.
Perfect. Go team. Okay, so as the equity specialist, I oversee all the discrimination law, anti-discrimination laws. So one of those is, so it's about equity for all students. And for diverse student populations, there can be some differences in, there can be higher rates of mental health issues. And when we're looking at discrimination, if they have mental health issues, there can be higher levels of victimization. So these are our populations that are already sometimes discriminated against and victimized. But then when you have mental health on top of it, it increases those levels and increases anxiety. So when you need to consider, not every student is the same, and so there are cultural differences in their perceptions on mental illness, social norms and rules regarding mental illness, and just expressing emotions. And we don't have to know what all of these cultural differences are, but just be aware when you're looking at your diverse student populations that take those into account. And so there are traditions and family dynamics that can actually be a buffer. So sometimes they can be a negative contributor. Sometimes they're very positive in managing anxiety. So when you're looking at, when I say individualism versus collectivism, you look at some societies. So for instance, we're looking at Asian, right?
I'm
being very efficient in my language. I'm combining words. So Asian Americans, I've found, have the lowest rates of the 4 major anxiety disorders listed here. And so it's kind of that collectivism concept where they are focused on community, and that can be a buffer for anxiety. Whereas individualism is more associated with our white American population, and they have the highest rates of the 4 major anxiety disorders. And then African Americans, looking at their cultural history, I think accounts for the fact that they have the highest rates of PTSD. So this is all an awareness piece of our student populations. So some of the challenges that they can have in school that can increase their anxiety is perhaps their English proficiency and their lack of knowledge regarding cultural norms and expectations. So these are our refugee students, immigrant students, English learners. It can impact their anxiety. I can't even imagine, as you're talking about speaking French, I go into a French class and I'm lost and I'm anxious. I've never been to a French class, but I can just imagine if you're coming from another country, you speak no English whatsoever, and you're expected to go into a classroom and learn at the same rate as your peers. That can cause a lot of anxiety. Perceived discrimination is associated with anxiety disorders. So that's if the student is perceived that they're being discriminated against. Here's some stats on our LGBTQ students. There's the 2017 National School Climate Survey reported that the most common reason for LGBTQ plus students dropping out of high school was mental health concerns, such as depression, anxiety, or stress. And LGBTQ students are almost 3 times more likely to experience a mental health condition. And that all came out of the GLSEN 2017 report. And then we need to be aware that what our diverse student populations are seeing in the news. And just having that awareness of what's going on out there can create anxiety.
Okay. I think that hopefully some of you guys have heard about becoming trauma informed, and that it's sort of becoming more aware to educators that our students are, impacted by the trauma that they have experienced in their lifetimes. I think, Holly put some interesting stats on here that 1 in 5 American children is a poly victim of trauma. They've had many and multiple types of trauma. We talk about ACEs, so adverse childhood experiences, a lot in schools now, and how that impacts a student's ability to self-regulate and ability to engage in school, and how that impacts their mental health. And I think that's important to consider when you're looking at anxiety, because a lot of times the ways that students are impacted by trauma in their ACEs can manifest and look a lot like anxiety. And we've talked a lot about ACEs, how when you're hypervigilant, your body is constantly in arousal, and so you're unable to concentrate, and that can also, it really is just a mega form of anxiety. You are constantly in a hypervigilant state, and that can be very difficult to engage in school. Our students that have been exposed to chronic trauma or any type of trauma, they may react really aggressively, and their hopelessness may be masked as indifference. So some of your students where you're saying they're not engaged with me, they have lack of motivation, they're not really going to work for me at all. It might not be that they're trying to be that way, it's just that they've been exposed to trauma and their ACEs are so great that they are having a hard time engaging with you. So I think it's just important when you're doing an evaluation, you're working with your school psychologist or whoever may be administering those, that's why it's important to look at a student's background, right? Are they a refugee student? Are they a homeless student in youth care? Remember that anxiety, ADHD symptomology and impacts of trauma and hypervigilance are all kind of enmeshed in one another. So it's just something to consider when you're looking at anxiety.
2 questions. One, is there a specific law regarding how much information can be given to general ed teachers regarding a student's anxiety and 504? And the second question, who can administer ACEs?
So I'll answer the 504. So the team will determine what the accommodations are and which teachers will provide the accommodations, or what staff in the school will provide accommodations. And typically it will be all teachers that need to be aware. And so we need to be highly sensitive, when we're looking at FERPA law. So only the staff who will be interacting with this student, as determined by the 504 plan, should have access to that information. Now, there are some student information systems which will flag students who have a 504, which I think is important because those teachers can see, oh, this student has a 504 or has an IEP. But only the information specific to that student, it should only be shared with those who will be providing the accommodations. And be aware that with the confidentiality, with the FERPA laws, be careful with your identifying information that you're sending through emails and things like that. So make sure it's a secured format.
Mm-hmm. I think the second half of that question, maybe if I'm interpreting it correctly, is that if you are taking a developmental history or you're interviewing a student and a parent and something comes up that they would not want shared with other people, maybe it's their sexual orientation or something that they've experienced in the past trauma-wise, that's up to your discretion whether or not you put it in the evaluation, right? If it is academically impacting them or is important for someone to know, put it in there. But you don't necessarily have to put verbatim everything that the student or a teacher or a parent tells you into the evaluation. So use some professional discretion with that. As far as ACEs go, so if you Google ACEs, it's a 10 question questionnaire. You can get it anywhere from the internet, really. And anyone can administer that because it's really just parent or child filled out. I think before you give it to a student, though, you probably need to work under your district or building consent regulations, because I would hate for you to give a student a questionnaire that asks some very personal questions without asking a parent first, or notifying the parent first that you're going to be asking those questions, because that could have some legal ramifications, and then that parent being very upset that you ask the children that that very specific and personal question that may affect how you look at their family and how you look at the student. So
well, I think that would connect again with FERPA law.
Yeah.
Because you're asking, when you're looking at Utah FERPA, there's very specific categories that you need parent permission. And definitely looking at ACEs questions, they would fall under those categories. So always get parent
consent.
permission parent consent before you administer the ACEs.
Yeah.
And make sure it's in a context that
Right.
is safe.
You don't just want to be like,
give it
hey,
to an entire class and watch,
Right.
that can trigger some severe
I know that
trauma.
there are some schools that will do ACEs questionnaires confidentially. So you'll just have a student fill out an ACEs but not put their name on it. That way the teacher can kind of get a gauge of where am I at with my class? Do I have a high rate of ACEs? Do a low rate of ACEs? What's my student population? But you should check with your building administrator and district before you do that. It would just need to be, there would be no names on it.
They're giving the ACEs in classrooms?
I think it depends. Like, or within groups. Like, sometimes if you're looking at a group of students and you're doing like school-wide screeners, or if you're going to work with a student,
Just because.
Yeah, that's a really
If you
touchy.
haven't read the ACEs questions,
Yeah.
I would really caution.
Yeah, so you just need to be very careful about that. But I would say if you're asking for specifically for this, anyone can give it. It doesn't require you any training in it. It's just a
Right.
set of questions. Okay.
Okay.
Okay, so these are some of the resources that we've used in this PowerPoint presentation. These are links that you can actually just click on and it will take you to the sites.
Only when I send out the PowerPoint, so on YouTube, it wouldn't be able to.
Oh, okay.
Yeah.
So Holly's going to send out the PowerPoint to those of you that have attended, and so they're links. Irregardless, you can always put these in to your web server and go to the link on your own. The whole school, whole community, whole child model from the CDC, a great resource for all different team members to look at and really look at how the child is not only supported in the educational system but also community-wide and also in their family. Principles of practice for the role of individualized healthcare plans. Of course, since I'm a school nurse, I'm going to tell other school nurses this is a great guide for us in looking at healthcare plans, and a guide to tell us what are restrictions or things that we should be looking at putting into our healthcare plans.
And I want to point out that Parent and Educator Guide to Section 504 is put out through the U.S. Department of Education through the Office for Civil Rights. The one above that is the Administrator and Educator Guide that I mentioned earlier. And then at the bottom, BOTVIN's life skills training is required by Utah law to be administered. It's typically being administered in health classes, but there are a lot of life skills components in that when we're talking about coping skills and things. Did you want to say anything further about any of the resources that you put on here?
I think the Jessica Minahan one is on that bibliotherapy slide.
Okay.
But also, I think in general, if you're looking for some training for your staff, contact your school psychologist. That would be a really easy way to do that, right? Just ask them, would you feel comfortable presenting on anxiety? Because most of the time that basic information about anxiety in schools, your school psychologists have that knowledge. You kind of have an expert already in the building, and they can tailor that to what your staff needs. Like if your staff has already been well versed in anxiety training, then maybe they need something a little bit more developed. But most of the time they just need some basic information on what is anxiety and dispel some myths about mental health.
Well, and a lot of schools might not have, especially
Right.
charter schools, might not have school psychologists. If you have a school counselor, if you have a school nurse, someone with that skill set,
Yeah.
Social
they can be a,
worker.
real,
Social
a social
worker.
worker, right? And you might have one that you're sharing with other schools.
Yeah.
Youth mental health first aid. So this is Holly. You're gonna have to chime in on this. I don't
Oh,
know
okay.
this one much.
Well, it's an all-day training, and aren't you? Who's trained on youth mental health first aid training? No, okay.
I'm not a trainer.
Okay.
The school nurses,
School nurses.
most of the school nurses went through that training. If they didn't do that training, they did a separate mental health training, not the full day, but a 2-hour training.
It's a great training on just an overview of mental health, the risk factors.
A lot
that
of
you're
districts
facing.
offer this from their own departments will offer it.
I think counselors, a lot of times,
Yeah.
the social workers or counselors are offering this to all staff at staff meetings.
If you
so this
don't-
is a good one to ask for.
Yeah, if you don't have it available, you can contact Christy Walker at our state office. and her email is there. It's just a great comprehensive training on mental health in schools.
So we've all contributed to bibliotherapy resources, and I know that Lauren has also talked about the behavior code. Again, what to do when you worry too much, a kid's guide to overcoming anxiety. And as school nurses, there's a whole set of books that can be used by school nurses and teachers and the other social workers, and psychologists part of the team. And it's a whole series. This one, Taking ADD or ADHD to School, I'm holding up. Taking Weight Problems to School, Taking Anxiety to School, Taking Depression to School. And these are excellent resources. It can be K through 3rd, K through 6th, depending on the topic. And again, there's the anxiety workbook for kids, Taking Charge of Your Fears and Worries, Using the Gift of Imagination is also a really good book. All of them are very helpful.
Do you want to talk about any of yours?
No, most of the ones that I have on there, What to Do When, there's a whole series for that. The Strong Kids curriculum is a really good resource because it works on a lot of skill sets that students with anxiety may need, and you can kind of pick and choose from those lessons which ones you want, and they're very nicely delineated and written out for you. Yeah, those are the main ones that I put on there.
And this is just for fun. Anxiety is not fun, but
the little teacup's cute.
It is.
it is cute. Okay, you've been asking questions as we go along. I know we've probably lost some people, but again.
Actually, we still have.
We still have
67
everyone?
people with us.
Awesome.
Oh, yay! Okay. So any additional questions, and if something comes to mind after we're done, you can always contact us. Sometimes there's a lag, so.
Yeah, we'll give it a
Yeah,
second.
there's actually about a minute and a half lag
Oh, is that right?
Oh, okay.
between what I'm seeing and what's happening in the room. So
Okay.
we'll
No,
just
it
sit here
depends on
for.
their bandwidth and things like
Yeah.
that too. So,
There's
well,
here's one more great Usborne. I don't know if that's saying that correctly. Book called No Worries. It's an activity book.
Oh, okay.
Okay.
and what is it called so that everyone can hear that?
There's a great USBORNE book. Usborne.
Oh, okay. And
I'm not
they
familiar with
they can
it.
see it on the chat if they're online,
Yes.
and that's everyone can see that on the chat.
And just a reminder to everyone, this question has come up several times. We will be sending the PowerPoint out, so you will get the slides, and this link will be there forever and ever and ever. So,
And also, I know school nurses didn't sign up, so anybody who didn't sign up through Midas, we'll make sure that people get it. I don't know if you want to send it out through the school nurses.
yeah, I can send it out through
So
the
Betty's
discussion list so everybody
can
gets
send
it.
it.
There's only a handful of school nurses that have indicated they're listening, but I bet there's more that haven't just put their name in.
Okay.
So rather than miss you, I will just send it out to everybody.
That sounds.
That's great.
And I'll probably send it out through my 504 listserv as well. Okay, so thank you for joining us. Here's our contact information. And we appreciate all your questions. Anyone else want to add anything? I love my team.
No, I mean, this has been great. I'm glad that people appreciate it and it's been helpful. So, really, awesome.
Don't hesitate to contact any of us
Yeah.
if
Yeah.
questions come up at a later date, or if we can help you in any way.
And for 504, if you have requests for future trainings, please let me know. I want to do a whole series on what would be helpful in schools. So. Okay, well, have a great day. See you next time.